it's important for all of us to be able to be prepared to manage the pressure that comes with coming out of COVID-19. We're all working on coming out of COVID-19 and working toward the future. And some of this has to do with how we are caring for our loved ones. Today, we've got Jennifer Lepard, who is the president and CEO of the Alzheimer's Association of Michigan chapter, with us. And we're going to be talking about Alzheimer's and how we care for individuals that may have Alzheimer's. So, Jennifer, thanks so much for being with us today.
Thank you so much for having me.
It is my pleasure to have you here today. And I'm really excited to be able to talk to you because I think it's important because, COVID-19 brings its own pressures along. But if you're caring for others, that brings a whole nother layer. So, one of the things that I wanted to ask you about, because it is challenging when you're caring for others in this way, is first and foremost, are those living with Alzheimer's more susceptible to COVID-19?
Alzheimer's itself does not make somebody more likely to develop COVID-19 or to suffer from the effects of it. However, many people living with Alzheimer's are older and have many other conditions that would make them more susceptible to developing COVID-19.
Now, what would you say are the impacts on people that are living with dementia and their caregivers?
Caregiving is a very isolating experience in any circumstance. And certainly when you are dealing with a lockdown situation and the loss of supports, it's even more of a struggle. So you have to think that there are some caregivers who are not used to doing caregiving 24/7. They might have had their loved one in an assisted day center during the day. They might have had people been coming into their homes to help them out, and those services might no longer be available to them, which is putting a lot more pressure on them. The other challenge you have is explaining to someone that has Alzheimer's or a form of dementia why they can or cannot do certain things, explaining why they can't go out anymore, why they can't go to the day center. These are things that they're not going to be able to store and remember, putting, again, added pressure on a caregiver to try to maintain the new regime that we really need to do, washing hands all the time, things like that.
Now, can you talk a little bit about Alzheimer's in Michigan and our nation?
Alzheimer's, there are almost 200,000 people in Michigan alone living with Alzheimer's, and we estimate over 500,000 people are caregiving for those people. So it affects everybody. Almost everybody knows someone that is suffering from Alzheimer's or caregiving. The disease is the biggest risk factor for Alzheimer's is age, and Michigan is an aging state, and so it is continuing to grow across the country.
Do you see this as something that more Michiganders are going to be impacted in the coming years then?
Definitely. Michigan is an aging state. And like I said, the biggest risk factor is aging. So it is going to continue to be a problem. It is really the most expensive health problem in the country right now. People can live with Alzheimer's on average from between 8 to 10 years. And if you think about the amount of caregiving that takes, especially when you're talking about people that might need to leave their jobs, and they're also raising children at the same time, the pressures, both financial and just in terms of their daily lives, are immense.
How exactly can folks connect with the Alzheimer's Association of Michigan chapter for support and resources?
We are so happy that we have been able to move so much of what we have done online. So we have education, support groups, early stage programming that we have all transitioned to online services. You can reach us by calling our 1-800 number at 1-800-272-3900. That's staffed 24/7, and you will be connected with available services. They also have on that line social workers who can just deal with any issues that you might have. Sometimes we have people that call and just need some help and need some venting, need some help with behavior issues. You can also reach out to us on alz.org/GMC for Greater Michigan chapter, and all of our resources are on there as well. And we continue to provide programs in the state of Michigan. So please reach out to either the 1-800 number or the website and connect with us. And we are happy to just talk to you about what your needs are, what your struggles are, and how we can provide assistance.
Oh.